Okay, great. We're going to go ahead and get started. We want to thank everyone for joining today's call. This is really meant to be a peer support call on responding to the housing needs of youth, especially during this time of COVID-19. And so this call is really meant to support all of us in being able to cross-share both challenges, but also creative opportunities and solutions that we have found helpful, that you all may find helpful, so that way we can all learn together. So although we do have a few panelists that will be sharing what they've seen and what they're working through, we would love to hear from all of you in the audience. So please use your chat to kind of share with everyone and with both attendees and panelists, what you're seeing, what creative approaches you're taking as we're kind of going through this together. So we just want to make sure that everyone has access to their chat box. So if you look right at the bottom of your screen, if you can just type in where you're joining us from, that would be really great. Just to make sure that it's working for everyone and we can see your responses. So if you can just let us know what city or state you're joining, that would be great. Okay, so it looks like we have some people from California, LA, New Jersey, San Diego. Great. Okay, perfect. So it looks like that's working. Again, we encourage you to chime in utilizing your chat box. And as you're going to see on the screen that we have up currently, we have a couple of webinar tools that you can use to just engage with us. So you can use your chat feature in the one that you just chimed in on to tell us, again, questions that you have as we go through today's call. Also, if you are experiencing challenges that you're concerned about or you're unsure how to work through them, please put them in there. If there are creative solutions or partnerships that you have found to be really useful, especially during this time, please put them in there, and we'd love to hear from you all. We do have closed captioning for today's session. So if you look at the bottom of your screen, there is a CC or closed captioning button. Just click on that and then they'll launch the closed captioning for you. And when you do respond or when you do ask questions, if you select all panelists and attendees, they'll just we'll make sure that everyone is able to see it both on the panelist side and also on the attendees. So that way, if an attendee has some suggestions for you, that would also allow us to have this collaborative learning opportunity. All right, next slide. So we just want to give a brief overview of who we are. My name is Karen Romero. I'm the Training Institute Director for Freedom Network USA, which is a coalition for anti-trafficking service providers, advocates, and survivors working to address human trafficking. Through this organization, we have a housing training and technical assistance grant that's funded by the Office for Victims of Crime under the Department of Justice. And through this project, we really work to support service providers in identifying housing solutions for survivors of trafficking, both in access, but also in learning about new resources that you may be able to tap into. So we do bi-monthly webinars, we have a resource library, and we do one-on-one technical assistance. So we encourage you to look up freedomnetworkusa.org, and you'll be able to find the information for the housing project there. Next slide. So I want to just take a moment to introduce our panelists today, who are very kind to join us and just share, again, some of their lessons learned. So we have Aaliyah Howard, who's out of the International Institute of Buffalo. They're based out of Buffalo, New York, and she is a coordinator for human trafficking services. Also, they provide support services for survivors of trafficking and domestic violence in order to work towards safety and self-sufficiency. And she's also the primary contact for the Erie County Safe Harbor Program for trafficked and at-risk youth. And so she leads a lot of the community collaborations focusing on identifying the needs, the gaps in service, and supporting at-risk and trafficked youth. We also have Andrew Palomo, who's the Director of Community Strategies for National Network for Youth. They're based out of Washington, D.C. However, he does have 15 years of experience working with runaway and homeless youth. He has been actively involved in youth subcommittees in his local continuum of care, where he led the first youth count in his area. He's also a key partner in implementing Allenstown's first drop-in center for homeless LGBT youth. And finally, we have Julie from Preble Street. They're based out of Portland, Maine, and Julie serves as the director of their anti-trafficking services. Over the past decade, she's held a number of positions across the Mid-Atlantic, and she's most recently managed a statewide training program for child welfare professionals across Pennsylvania. She's also previously managed emergency domestic violence shelter that had 100 beds, and she has a lot of information and background on trauma-informed and culturally competent services. So I want to go ahead and move forward. So we'll go to the next slide. And we just want to get a sense of who is joining us today. So we're going to launch just a few polls. If you'll just, as we launch these, you will just click on your selection. So we just want to get a sense of who's joining us today. So if you have a residential program or shelter, just let us know. If you don't, that's fine. Just go ahead and put no. We know that both programs who do have shelters or residential programs and those who do not are both having challenges, some with serving survivors or individuals within the program and some trying to access programs. So we would love to kind of get a sense of who's here with us today. So if you'll just go ahead and click on your selection, and then we will show the results. Okay, so it looks like it's a good mix. There's a higher number who do not have residential programs and likely are trying to access shelter or housing for those youth that they're working with. Great. We're going to go ahead and go on to the next poll. And so we want to know where your clients are staying, specifically your youth clients. Are they staying in a shelter? Are they staying with friends, family, foster care? Are they involved in the child welfare system? We do know that a number of traffic survivors are also in juvenile detention facilities or in other, if they're unhoused, please let us know as well. So if you'll just make your selection so that way we know what systems these youth are also accessing and who you may be interacting with. So we'll just give it another minute. Great, and we'll, okay, so it looks like the majority are staying with friends and family. Some are in shelter, some are in child welfare systems, and there are others. If you selected other, if you wouldn't mind in the chat, just let us know what those other situations are. It'll just be helpful to kind of have a sense of where youth are staying. So it may be that they're unhoused. It may be that you know, they don't have a place to stay, which we know is a challenge right now. So if you selected other, yeah, so it sounds like a good number are unhoused. Okay, thank you for sharing that. Perfect. And we're going to do one last one. So for those that are serving youth, we just want to know if the program that you work with, are you working with youth specifically? So when we say unaccompanied youth without their family, it means that the youth is your primary client, or are you working with youth and their families where a young person might be your secondary client because maybe their guardians are accessing your services? So just let us know kind of what interactions you're having or how you're having those interactions, whether it is the young person who's having the primary service provision or if it's youth and their family. Okay, and it looks like we're going to have to relaunch it because it seemed like it was not giving people the opportunity to click on an option. Okay, so let's try that again. And we're going to go ahead and let you make your selection of who the primary client is for your program, whether it's the young person or if it is youth and either guardians or family. Okay, and we're going to go ahead and show. Okay, so it seems like it's almost half and half, where some are specifically focused on youth and some are more broad, where they may be serving families or members within that family, and then the youth may be also partaking in some of those services. Perfect. So thank you for letting us know kind of where we're at, who you're working with. What we're going to do is, again, we want this to be very much a collaborative effort between everyone who's on the call. That includes all of you as attendees. And so we're going to have our panelists just share a little bit about their work, what they're doing, what they're seeing specifically during this COVID-19 pandemic, and how it's impacting housing for youth survivors, some of the challenges that they've been experiencing, some of the opportunities that they've been able to work through. And then we want to hear also from you. So if you're hearing something that you're also seeing in your local area, please let us know. If something sparks your interest or you want to learn more, or you've seen a resource to be able to address some of the challenges that we talk about today, please put it in the resource again, or in the chat box. We want to compile resources and cross-share a lot of the information that we are able to come together and learn from each other. So we're going to go ahead and start off with Andrew. He's going to give us a more overarching view of kind of what he's seen and the landscape across the U.S. of how different programs are responding to this, especially from a runaway and homeless youth system. And then Aaliyah will go next, and then we'll have Julie. So we'll go ahead and let Andrew take over.
All right, thank you, Karen. Like Karen said, my name is Andrew Palomo. I'm at the National Network for Youth, and I'm the Director of Community Strategy. So some of the things that I do is I work with various communities throughout the country in order to end youth homelessness, or help them establish their goals to end youth homelessness in their communities. So during this crisis, there's been a lot of challenges that a lot of our member organizations have been experiencing, right? So I think one of the biggest ones that I've been hearing in all our communities is how to encourage our young people to follow the stay-at-home orders or to self-isolate, right? I think that's something that a lot of our congregate cares and our shelters have been experiencing, of like how to educate our young people about what's going on, in addition to helping them, like, hey, how do we help you stay safe throughout this crisis? So that's been a big challenge, and some things that we've been seeing is talking about those opportunities, right? Like I think our organizations have been engaging young people in various ways in order to make this happen, right? So I think that's been one of the strengths that we've been seeing, has been like how a lot of our members have been extremely innovative, and then also their adaptability, right? Like, so they've been able to adapt their programs to the current needs, right? So, and when we say adaptability, we've been seeing that a lot of our programs are using a lot of some of them might be using social media, or using like Zoom, or other forms of engagement strategies in order to get information to young people, and as well, in addition to doing those check-ins, right? Like being able to make sure that they're safe, right? So I think those are some of the like the big picture challenges that we've been seeing, in addition to finding housing, right? Like I think that's been another big thing that our members have been saying over and over, that like, how do we then isolate our young person in a shelter that's already we're already full. There's no place for our young person to isolate. So that's been another thing we've been working with our communities in order to think outside the box, and maybe reaching out cross-sectorally, working with other programs, working with hotels, using those emergency funds, which I'll talk about more in depthly later, the CARES Act, right? Like how do we then use those opportunities in order to establish some of those emergency housing solutions or short-term housing solutions? So that's the big picture, and I'll leave it at that, because I know there's questions to go more in detail in some of those areas.
Perfect. Thank you, Andrew. We'll go ahead and turn it over to Leah.
Hi, everyone. Thanks for the intros, Karen, and for setting us up nationally, Andrew. So in the work that we're doing at the International Institute, we're really focused on providing trafficking-specific client-centered case management for survivors of all ages, all genders, all trafficking experiences, all citizenship statuses, countries of origin. But for our call today, we're really focusing on youth and youth housing. In Erie County, we're seeing youth housed in a variety of different places in different ways. Some of them are safe and comfortable as designed by youth. Some are not, also as defined by youth. You know, as we're kind of managing all of these changes with COVID, we're running into some challenges where we see youth in situations, you know, staying at home, in guardians or other places that were tense before all of this started happening, and we're seeing the tension really rise, whether that's home with guardians or extended families, other kind of guardianship placements, or in residential homes and settings, right? So we're seeing that kind of tension of, you know, kids not being able to be with peers in schools, not having all of those other supportive adults in place. So we're seeing a lot of that impact there. But we're also working with lots of youth who are in homes with guardians who are not financially stable, who don't have access to the mental health supports that they need to. And so we're finding ourselves doing a lot more of that family support, or a different type of family support that we would have on kind of maybe a normal day. We're seeing changes in how family court calendar is running. You know, when are review dates coming up for youth to be able to be returning home from facilities, or when are they going to be let out of the detention facility and things like that. And so really the strategies that we're finding to be most helpful are ones that really are leveraging our partnerships with community collaborations, either through the legal department at social services to pull cases more quickly if we can get youth out of placement, if there is another safe option, and kind of changing some of those calendars around, right, to get folks out of detention as soon as possible, because the county absolutely agrees with us in that, you know, if there's another safe option, we don't want youth to be in care and sharing all of those kind of germs and whatnot if there's a safe option, right? You know, we're really focusing with youth and with their guardians or their service providers to kind of keep that frame of human rights and harm reduction with young people, as we're navigating how do we promote CDC guidelines, how do we promote physical distancing and all of those things as well. You know, in terms of ways that we're trying to kind of meet these expectations and these needs for folks, one of the things that I think has also been really helpful for us is to acknowledge that it's been relatively easy, my staff would laugh at me, but relatively easy to make these pivots from a nonprofit that's fairly small, right? We knew very late Sunday night that by Monday we were going to be transitioning to work from home. We had laptops and video chat capacity. We had everything ready very quickly. And so we're able to transition to support youth very quickly as well. But lots of our partners haven't been able to make that transition. So we find ourselves doing a lot of that kind of bridge work, both with our clients, because that's our primary focus, but then supporting our partners in different ways too, right? Helping them adjust their referral process to be able to get youth into RHY shelters if that's the safest option for them, helping navigate the why isn't my so-and-so, you know, service provider coming into the home as regular? How do I not have it? Like, we're doing a lot of more of that bridging piece of things. But I think that those are really the key challenges and creative strategies that we're coming up with so far, but it's very much a work in progress. As we figure one thing out, the next day happens and something has changed, and we've got to really keep kind of rolling with those to stay flexible. But I'll wait there and talk through some of these questions with you all.
Great, thank you. I'll go ahead and turn it over to Julie.
Hi, everyone. Again, Julie Kesselman from Preble Street, where I'm the Director of Anti-Trafficking Services. So actually, I think Aaliyah did a really good job of covering a lot of the same things that we are doing right now with our young people to kind of continue engaging them and working with them during this really strange time. Our youth case managers had a lot of success connecting with young people via WhatsApp. So we're really using WhatsApp right now, which is an encrypted service to keep in touch with our youth, offer supportive counseling and safety plan. Our youth are at a variety of places in the community, like the youth you serve. Many of them are at home with their parents, whereas Aaliyah mentioned tensions are in some cases rising as youth are in unusually close quarters. A lot of the safety planning that we've started to do is really safety planning around maintaining social distancing and how to stay safely at home when home might not be really the safest place for our young people. A lot of safety planning around staying in your room, just kind of not engaging with other household members. It's been challenging, but I think our youth case manager has done a really good job of kind of meeting our young people where they're at. We do not operate a shelter, but in our anti-trafficking services program, but at Preble Street, which is a multi-service organization, there is a separate teen shelter that's accessible to any young person who's experiencing housing insecurity. And I can talk just really briefly about a couple of things they have done that I think have been helpful. So in order to create space for social distancing, they have moved beds into every available space in the shelter. And so the living room and lounge areas are now places where beds have been set up. And that's something that they've done in order to make sure that there's like 6 feet of space between every bed. Another thing that we're implementing is that anytime that there's any reason you need to be making direct client contact, everyone, staff and clients, is required to wear a mask right now. I understand that there might be some programs where requiring clients to wear a mask might be challenging. It could be traumatizing. So we're really encouraging case managers to talk to clients before masking about like why it's really important for safety, for their safety and for ours, explaining why we are wearing masks, because it can also be really jarring to be having a conversation with someone who's refusing to come more than 6 feet close to you and is wearing a mask. I do think that those, I can't say I'm not a healthcare professional, but I do think that those measures are helping. At our adult shelter, there have been a couple of folks who have tested positive, but we've noticed there's been very little community spread. And I think it's because of really working on maintaining that 6 feet of social distance and really rigorous masking, hand washing, and sanitizing, which I'm sure are a lot of the things that your programs, your housing programs, are already doing. And yeah, other than that, I think Aaliyah did a good job covering a lot of the other kind of challenges and work that's happening right now.
Great, thank you all. That was really helpful to get that overview. So I'm going to go ahead and start with some of the questions that came in through the registration email. There were a number of attendees who are here today who submitted questions for panelists. And as we ask these questions, please feel free to also for attendees to share what you all have been doing in response to some of these challenges. And if you have questions, please feel free to add them into the chat box. So we'll go ahead and start talking about what do providers do when there are no trafficking shelters. So Aaliyah, I'll start off with you, but of course people feel free to chime in. What can be done to help get more shelter placements for youth, or who can people turn to when they're not being able to find trafficking shelters to house the youth that they're serving?
So in Erie County, we don't have a trafficking specific youth shelter right now. It's something that's in conversation. That's one of our long-term plans with the county and with our partners to see what we can do to increase capacity in those ways. But right now what we're doing is looking at partnerships with our runaway and homeless youth providers. So we've got a shelter, we've got a drop-in center, as many communities I think do. But we're really doing a lot of support with folks that are running residential placements to talk about trauma impact of trafficking, talking about ways that we can support youth that are in placement, obviously with youth's involvement and with youth's permission, right? We do broad training around recognizing trafficking and trauma impacts and those things like that. But we're also really working with youth in terms of what messages do they want staff to hear and helping navigate some of those conversations. We're also really working on providing in Erie County additional support for either current or prospective foster parents to increase capacity for fostering for youth whose homes just aren't safe or aren't safe now. Maybe they can be in the future. But again, to increase that capacity for folks, lots and lots of training, lots and lots of communication. And our long-term plans look like We've got an RFP out in our county now to have another respite shelter that's really designed to be trauma-informed in ways that research show us is helpful for youth who've experienced trafficking. You know, that's one of the long-term plans. The other kind of probably longer term plans, honestly, is to really work to shift the culture in some of the other placement facilities to promote trauma-informed care. I mean, research says that when staff are trained in how to support youth who have experienced these types of trauma, that's when we get those better impacts. So it's a broader, we've got the right now, the how do we get somebody into a successful runaway homeless youth placement? How do we make home be safer or a guardian be safer? And then all of those kind of increased community capacity and then training plans. It's all of those combined.
Great, thank you. Anyone else have anything to add before we move on to the next question? Okay, perfect. So you talked a little bit about this, the need to have trauma-informed care. And one of the questions that we received was, what's the best way to be trauma-informed or to provide services in a trauma-informed manner while being realistic about the limited resources at this time? So we'll start off with Julie, but I'm sure everyone has thoughts on that.
You know, I always say that it is being honest is actually part of trauma-informed service delivery. I think a lot of the clients that all of us across the country work with have been misled often in their lives. And people have often been dishonest with them, have misled them, have told them things that just aren't true. And so I actually think that like being really honest and upfront is part of being trauma informed. And of course, you do that in a way that is competent and kind. But I think that our case managers have done a really good job of explaining to clients right now, we're in a crisis right now. What that looks like is XYZ in terms of housing and access to resources. Here's what we do have available for you to start accessing. And I think one of the good things is there are more resources available now. I think getting them can be challenging in its own way. But there's more unemployment funding available. In Maine, they just made more unemployment funding available than is available nationally. And so there are, you know, I think there are a lot of things that we can offer. And so I think being honest about what we have and what we don't have, but making sure you're also like presenting all of the like robust options that are available right now, making sure we're presenting those. And I know that Andrew is going to talk a little bit about the housing piece of that, but there is housing specific money coming through the CARES Act that's specifically for ESG, rapid rehousing. And so we have not started offering that to our clients because we're not totally sure what that's going to look like, but there are options available. I think all of us as professionals just have the obligation right now to be really honest with our clients about what's available and what isn't.
Great. Ilya or Andrew, do you have anything else to add on the trauma-informed piece?
No, I think that, Julie, I would 100% agree that honesty piece of it, that's how we build trust, that's how we plan for safety. And I think one of the things that we are noticing now more than I think ever before is that the information that we have that we know to be as accurate as possible today at 3:29 p.m. is not the information that is going to be accurate and the best information we have tomorrow morning, right? So we're framing it as that information and the option that we have right now. Things are changing, we'll keep communicating with you. And so we're highlighting that we recognize and anticipate this to change. So we don't have a lot of that concern from clients saying, well, you told me yesterday that whatever, because it was true yesterday, right? So we're trying to kind of manage that expectation of change to build that honesty. Absolutely, that's a great point. Thank you.
Perfect. And so knowing that funding and money is such a challenge right now, both for programs, but also just for individuals, Andrew, can you kind of give us an overview of what funding is available both for the program side, but also for individuals that may be eligible for additional funding?
Yeah, so like Julie mentioned, right, the CARES Act, which was passed a few weeks ago by Congress, allows has allocated funding to various sources, right? Like, so $4 billion was allocated to ESG, Emergency Solution Grants, right? So I think the COCs, your local continuum of cares, are the ones who are going to be the holders of that. So there is money that's being allocated for like rapid rehousing, for emergency shelters. It can be used for hotel and motel stays if you need to isolate someone. But those grants are, again, like being able to work with your COC, right? Like if there is a need that you're seeing, making sure that that need is being conveyed to your continuum of care. So that way they are aware, and then they can also allocate the money to where the need is in your community, right? So I think that's also something to be mindful with the $4 billion in ESG funds. There are also $5 billion that were distributed to CDBG, community development block grants, right? So I think that's also something else to be very aware of. In each community, the way that CDBG grants are distributed, it varies from state to state. So knowing who, some states it's like the Department of Economic Development, or at the local level is doing that. But those are also some funds for some medium solutions, like rental assistance for some for folks who might have lost their jobs and need to do that. So that's another area for people. So being able to advocate and whoever in your community distributes the CDBG grants, the community development block grants, is vital at this time. Also, the communities that have RHY, Runaway and Homeless Youth Act, so some youth-specific shelters, street outreach programs, and transitional living programs funded through HHS, just got distributed last week about $25 million. So each program was able to get an increase in their grants that they can then use for youth-specific programming, right? So I think that is, or youth-specific programming during this crisis, right? So that's another avenue for people that has been distributed. Those programs do have that money and can use it in that way. And then lastly, right, like I think like it is FEMA can play a role, right? They were allocated $4 billion to support people during this crisis, right? And then FEMA is distributed at the local, at the state level. So being able to know who your FEMA contact is, and a lot of this, a lot of these CARES Act money really is about like making sure that your voice is being heard, and that like the need for your community is there, right? Like so in the ESG, making sure the COC knows that like, hey, there's this need, there's a specific population that can really need this money right now. The same thing with like CDBG, the RHY, and then also with FEMA. So being able to let people know this is where the need is, and being able to then allocate that funding, right? So and a big thing is knowing who to contact. So the National Network for Youth does have a resource page. So I know FNTI is going to share that link. So we do have that a website that's dedicated to helping navigate all of this. So and then also I'm available as well. So reaching out, I can definitely navigate you to who that contact might be in your jurisdiction.
Wonderful. Thank you so much, Andrea. And so I think it's been very clear, and we've always talked about, you know, having collaborations in place to meet the housing needs of survivors and really all their needs. I think during this pandemic, it has become very clear why these relationships are needed, knowing that one sector, one field, one organization cannot respond to all the needs, nor should they, right? We don't have that type of capacity to like truly be able to successfully meet those needs. And there is a great opportunity for us to collaborate and leverage resources across communities. And so knowing that for anti-trafficking programs, we may be able to provide wraparound case management services. We may be able to share information, and we may be able to rely on our partners over in the runaway and homeless youth system to provide maybe some housing opportunities. They may have, access to, like Andrew mentioned, additional funding. Our friends over at the homeless and housing services system, they're going to have additional funding, right? And so again, it's really thinking about what are our needs. We need to communicate those, definitely during this time, but just in general, it is very important to be active partners in really looking at what can we offer, and also how can we be a good partner so it's mutually beneficial. Everyone's able to kind of bring something to the table. So that was really great. Thank you. Another question that we received was around unaccompanied minors. And so, Aaliyah, this question, we'll start off with you, was kind of whose permission do you need, or who's responsible for signing medical releases or waivers for unaccompanied minors during the pandemic?
So this might be one of those responses that is state by state. What I can say is that in New York, there haven't been any waivers to either timelines for things like child welfare investigations or kind of guardianship, things like that. All of those timelines are the same. And all of those requirements that I'm hearing from where we are here in Erie County in New York, those haven't changed. So what that means is that whoever is the legal guardian is still the one that's required to be signing those forms, whether that's ORR, the Office of Refugee Resettlement, if they are kind of in custody of an unaccompanied minor, whether that's youth who are in county or state custody. Those are the folks that are still required to be signing those documents. Obviously, if guardian has custody, then they're the ones that are signing them as well. It's definitely something that we navigate a lot, especially with some of our older youth who are maybe 17, maybe wishing that they were, going to turn 18 tomorrow, but aren't quite there yet, who are struggling to access medical care without accessing guardians and things like that. It's absolutely a challenge, but I have no local updates that any of those guardianship requirements are changing because of the health crisis right now.
Thank you. And I think along with that topic or question, people also wanted to hear about what are the legal aspects of housing a young person as far as contacting guardians. And I'm assuming this applies primarily to minors. So if there's a program who a minor shows up to, what is their responsibility, their legal responsibility, and who do they need to contact?
So Andrew might have a broader response to this, so I will certainly pass this to you very soon. I'll say that, again, in New York, there's a requirement to notify guardians, and there's a specific number of hours in which that needs to happen. I also know, though, that different runaway and homeless youth providers navigate that kind of informing of guardians in different ways, right? So there are ways that they're calling guardians. Some of the providers are calling guardians and saying, so-and-so is here, they're safe, let's come up with a family plan, and kind of supporting from the very beginning that need to navigate safety and kind of build partnership in those ways. I think that that's gone through some transitions, at least locally, which is exciting to see. I think that they are doing things in a much more trauma-informed manner here, but in New York, there is that requirement to notify guardians in a specific number of hours.
They are state specific. So I placed two resources, one from Schoolhouse Connection, which are state laws on minor consent for routine medical care, which I think that's what, so each state has different requirements. I put that in there from Schoolhouse Connection. They collected a nice job. And then also another resource for us, Alone Without at Home, a state-by-state review of laws. It is from 2012, so we're currently updating it. So take it with a grain of salt if some laws don't change that quickly, but I can't guarantee that this is the most up to date. But we did do a review state by state to review their laws, and every state's different. So just make sure to look at that, and then possibly even look at your own state, like your own state legislation to see if there's been any changes.
Great, thank you. And another question that we received was on what are some of the challenges that you're seeing, especially for runaway youth during this pandemic? So with those youth that are running away, what are some of the challenges that you're seeing? What are some of those trends? And then in addition to that, what are some strategies to keep runaway youth safe right now? So we'll start off with Andrew, and then other people can chime in.
Yeah, and I think currently in the pandemic, we've seen a rise in runaways, right? Like I think in the data from the National Runaway Safe Line has suggested that they've actually received more calls during this pandemic. So for those of you who are not aware, there is a national hotline, 1-800-RUNAWAY, where young people can call and be able to be linked to services near them. And also they work with Greyhound in order to get young people back home, right? Like so, and at least from last week, that was still an option, and that partnership was still working. So that's just something for everyone to note. 1-800-RUNAWAY to give out to young people. But I think one of the challenges has been a lot of our shelters, especially in hard hit areas, are full, right? So I think like where can we house young people? And I think that's been one of the biggest challenges now. And then the second, really how to keep them safe, like Julie mentioning those safety plans. I think that's been something that what we're hearing from our providers is that like they're doing a lot of like these harm reduction kind of like safety plans. Like, all right, where can you go to next, right? Like, who can you go to? Who's a safe, trusted family member who might be also self-isolating, so the risk is lower of, and I think these are having those asking those questions. I think those it's both like something that we're seeing, but it's also another challenge during this for runaways.
Perfect, thank you. The next question is for Julie. So, knowing that there are a lot of youth who may not want to be told exactly what to do right now, and I think that's just normal adolescence. What are some ways to really think through how can they continue to be safe? I know right now some providers are hoping that youth will wear masks or self-quarantine. And so Julie, if you want to start us off, and then also Aaliyah and Andrew, if you have found any ways that has been used or successful with your program or with the programs that you work with, that'd be great.
Sorry, I had to take myself off mute. So I can talk a little bit about what we're doing, and also, like I mentioned, we do not have a shelter, but our organization runs a sort of general teen shelter, and I think something that they have done is encouraging the young people to talk to one another about social distancing and safety precautions. I think the young people that we work with often are more receptive to hearing things from their peers than necessarily a case manager or a program director. And so kind of having them, having the young people who are sort of like understanding and embracing social distancing and the new protocol that are in place, having them kind of be ambassadors. And then, sorry, what was the second part of the question, Karen?
What are ways, especially for young people who, or for programs who they're hoping that the young people will wear masks or, self-quarantine, what are some ways that can be trauma-informed that also allow choice? So kind of what's the magic recipe and the secret recipe to be able to still be able to have some of those values of trauma-informed and survivor choice with knowing that there are safety concerns at play?
Yeah. And I think, in terms of for programs that are concerned about implementing something like universal masking and, universal temperature taking, which we're also doing at our both youth and adult shelter that Purple Street that the organization operates, is that, people always have a choice. And I think, case managers really try and call that out, that, we understand that masking is uncomfortable, and we have the conversation with people about why it's important. Same with temperature taking, that some people are really resistant to. But we're having the conversations about why it's really important. And that like, of course, you know, you do still have a choice. If it doesn't feel safe for you to wear a mask in our shelter, then we will safety plan with you another place that you can go and self-quarantine, or we can figure out a way to maybe help you wear a mask that feels safe and comfortable for you. Maybe you don't want to wear one of the masks we have available. Maybe you'd rather acquire your own face covering. Maybe you prefer to wear a scarf or a bandana. But we'll really, I think that, you know, at the shelters that we operate, you know, the case managers are definitely willing to kind of plan with people around, you know, giving them some degree of choice while making sure that they're adhering to the protocol that are keeping everyone safe. And, you know, I was just talking to a coworker about it this morning, that I think we should really lift up the fact that, like, we have not had major outbreaks in our communities, and how powerful that is, and how that really speaks to everyone, including our clients, doing such a fantastic job of distancing. And so I think really lifting up how powerful they have been in stopping the spread of the virus in our communities, you know, can be something that, again, is empowering and shows them that this isn't just something we're implementing because someone recommended it. It really, you know, it is working and it's impactful and it's helping keep all of us safe. So that's kind of, I think, some ways to think about, you know, bringing the trauma-informed lens to safety measures that we really can't allow to be an option in our shelter right now.
Great, thank you. And Aaliyah and Andrew, if y'all have any ideas, especially, you know, given the social distancing that is encouraged, in knowing now that some states are going to be lifting some of those restrictions, you know, how do we continue to encourage youth to be safe when they, you know, people need that social interaction?
Yeah, and I think a lot of it, I think Julie hit it spot on, right? Like, but I think something that we're seeing, right, like, it's remembering like development for young people, like having friends and socializing. This is age appropriate, and this COVID-19 is blocking that, right? So I think something else to add is, how can we then still have that social connection, and like, how do we then like lower those barriers, right? Like, do we like, I've heard some shelters have been increasing their internet capacity, right? Have been using like, if a young person needs phone minutes, they're buying the phone minutes, right? Like, so that way, like, listen, I'm trying everything, or to show the young person that you're trying everything in your power to keep them connected with their friends, right, during this crisis. And I think having those conversations, right, I think has been really big. The other thing here in Chicago, the night ministry, like incorporating the Youth Action Board to really like either develop like flyers that are more, that speak to young people, versus like using the ones that like the Department of Health is handing out. How do you then turn that so that way young people can actually have like a voice and make it their own, right? So that's something. And then the use of social media. There's a drop-in center in Pennsylvania that's like made it a contest, right? With using social media about wearing masks, who has the coolest mask, right? Like, so I think that's another thing. Like, when we talk about like meeting young people where they're at, what does that mean, right? Like, and sometimes it is like, right, they're in social media, they're using texting and all of this stuff, and then how do we as providers help support that during this time?
Yeah. I'll add that we're doing, you know, lots of those things. We've spent, I think, more funds on phone plans and phone minutes to get increased data. You know, we're sending sketch pads, we're sending all of those kind of the things that youth can do in home while they're social distancing. We've really tried to emphasize doing those. And there are some youth that are just not in places where they can stay home and physically distance in the ways that we would love for them to be able to do. And so we're having all of those conversations about, this is why the CDC and Department of Health is asking that. Here are the options, providing all of those pieces of information. And if this is a youth that their safest option is to socially distance at their home and at a neighbor's house, and they're not going to other places, like that's harm reduction, right? They're going between one place and another, and we're really emphasizing and supporting and sending hand soap and saying, well, and you're going to wash your hands 400 times, and you're going to stay 6 feet away, while we build capacity to put a mask on and stay home maybe 4 days next week instead of 2, right? We're kind of trying to build and support towards that increased safety at the same time. We're working on it.
Perfect, thank you. A question that came in the chat box was around outreach, especially during this time. So do you all have any outreach ideas or solutions to inform runaway youth about the services that a program may have in order to keep them safe and off the streets? Especially because runaway youth, it sounds like those runaways are increasing, or those cases are increasing, and they may not have access to safe shelters. So what are some outreach strategies that programs who have capacity to serve youth can take in order to put that information out there?
So something that we observed, is having drop-offs in the same location, and making sure that it's routine, right? And making sure that if it's noon on Monday, that it's consistent, right? And I think that's something in a street outreach program in Philadelphia. That's what they've been doing, has been going to the same location over and over. They've also put their phone number, right? Making sure that they're leaving their phone number in places, so that way young people are aware that they're still open. We are hearing this, right? I think our program in Las Vegas said the exact same thing, that they know that young people are out there, but they've seen a drop in their shelter numbers. So that's that's been interesting. So young people just either don't want to go into shelter because they know it might not be safe in terms of social distancing, right? So I think some young people are aware of that, right? So are my options just better to be, sleep outside, right? So I think that's been something that at least in places where it's warmer, it's definitely something that that we're seeing. But I think it's just again communicating as much as possible through alternative media, right? I think the program in Philadelphia was using social media. They already had a huge social media following, so I think when this happened, it helped them. But I think for us as providers, thinking about the next crisis, and that all indications are that this might be cyclical, right? So if this is cyclical, then how do we then prepare for a possible having sheltering in place again, right? And I think those, how do we then use those alternative modes of communication?
We're working hard to make sure that other folks that are interacting with youth know that we're still open and still taking referrals. We've gotten a lot of referrals proportionately in the past week and a half or 2 weeks from folks that are not normally our primary referral sources to help us get connected with trafficked youth. And we're also, we stay connected with youth while they're AWOL, to be able to kind of provide food and basic needs and safety planning and those types of things. And we're having youth now refer friends to us while they're AWOL, right? So runaway youth linking other runaway youth to us in those ways, because we are doing everything we can to meet them where they are, including providing those food items, providing the hygiene items, and all of that other stuff. It's something that we're starting to see. We're not doing a lot of direct street outreach, but it's letting it be known in the community that we are still open and that we still have these resources has been helpful.
Julie, were you going to say something?
Yeah, so like I said, I've talked a little bit about the shelter programs that our organization does run that are not specific to anti-trafficking services, but I just wanted to echo that at anti-trafficking services, our youth case manager, myself, and the supervisor have really been trying to make sure that everyone knows we are open for referrals. We every meeting, every Zoom call, every opportunity that we have, every contact we have with the shelter, we're really trying to let people know that we are open, we are available, And I think that that's really important. I think because it's so different across programs right now, that like a lot of youth serving programs are not operating right now. A lot of services they usually get, they're just not able to. And so I think really letting people know if you are open, making sure people know that you're open, and if your services have changed, if they look different, if they're remote, letting people know that too.
Perfect. That's really helpful. I know we have just 5 minutes left, so I want to get to a couple more questions. One question that came in was around how to help empower young survivors to advocate for their needs, both on mental health, physical health, and just their overall well-being, knowing that this is a very stressful time. So what are some ways that service providers can be proactive in checking in on some of those needs that may not be as visible, by just kind of seeing a person? So we'll start off with Aaliyah, and then Julie and Andrew, if you have anything to add.
Sure. We're circling back to one of the tools that we talked to, or one of the conversations that we refer to as kind of a well-being safety plan that's more focused on mental health, emotional well-being, rather than just the kind of physical safety piece of things. And so we're checking in more frequently around that, and we're checking in ways that youth are telling us feel more comfortable, right? When we first transitioned to working remotely, I assumed that every call was going to be a video chat because, okay, we're just going to transition to video chat. That's what I had in my head. And most of the youth that we're working with are not interested in having a video chat with their case managers. We're doing 1 billion text messages a day through WhatsApp and through other kind of platforms, because that's what youth want us to do, right? So we're checking in as frequently as they want us to do that. And we're building up their advocacy skills and tools in the same ways, or really similar ways at least, because it's remote, as we would on a normal day, right? If there's a tension point with a guardian, what are some things that you want to say? How do we build those kind of communication strategies, and then how do we plan for advocacy around that? We're still organizing case conferences with youth as active participants and all of their service providers, right? It just, instead of having us all together in a room at a table, we're doing that all through video chat or through other kind of platforms to be able to make sure that youth's voices are involved at every step of the process in here. Go ahead.
Thank you. Andrew and Julie, do y'all have anything to add on that question?
Yeah, I think something else that I think that I'm hearing a lot is starting out your conversation. I know as case managers, sometimes we want to get right into what we need, but taking a step back and just saying how are you doing? And then also acknowledging that this comfort that we're all feeling is is real, and that it's this again, this comfort and this grief that everyone in the nation is feeling right now, because we're losing this freedom, we're losing the ability to connect with people. So I think that's also another thing to just acknowledge that that's how I'm starting a lot of my calls with our youth action boards, have been just this is normal. Well, it's not normal. It's this discomfort. Everyone's feeling it. And how are you doing? How can we better help you? What do you need right now? Right. And starting it off of that. And then later on going to, all right, I need you to sign this paperwork. And then these are the other things that I need. Right. So I think that's another strategy that I'm doing in my own personal work with youth action boards.
Great. Then the final question that I want to pose to all of you is, knowing that this is, again, not a normal time, what are some of the proactive steps that service providers can take? What are some of the resources to really start connecting to, so that way survivors of trafficking can get back on their feet after the pandemic? So what are some steps that we can take now, so that way, as this continues to evolve and hopefully diminish, people will be able to get back on their feet? I'm going to open that up to everyone.
All right, I'll try and start us off. So I think some of the ways that we're focusing on that in terms of long-term stability and kind of keeping folks going for whenever this is over looks like a lot of supporting self-care, mental health, physical health, right? How do we help folks maintain safety, all of the realms of safety as much as we possibly can through this? And we're shifting towards working on goals that are accessible right now. Right? There are so many things that are closed. We can't help somebody get a copy of ID or working papers right now, but we can help them coordinate with their principals about what their next semester is going to look like whenever school happens, right? So we're shifting towards the goals that folks can do now, and then doing a lot of that kind of how do you take care of you, really building and kind of expanding resources for coping and maintaining. So we're ready for whatever comes next.
That's amazing. And I think we're doing a lot of the same things. And, this is sort of something that we started before COVID-19 broke out, was really working on financial empowerment with our clients. And actually just last week, one of my supervisors got a message from a client saying, I know I'm going to make it through this as hard as it's been. And I know it's going to get harder, but I know I'm going to make it through this because you guys gave me all of those tools that I needed around budgeting and financial independence, and I've been saving money, and I have money to pay my rent next month. And I think that that's an outlier. I don't think that that's like a regular occurrence that we hear that kind of thing, but I do think that this crisis has us thinking a lot more about how important it is to help clients plan for like all sorts of different kinds of emergencies that come up, that it's always a good idea to have extra rent money saved, that it's always a good idea to kind of have like not just a personal safety plan maybe around a trafficking situation, but sort of like a larger safety plan. What are you going to do in an emergency? Who are the people that it's important for you to contact? So just kind of thinking about how this crisis has like prepared us for, like Andrew said, another possible like bump in cases and us having to go into quarantine again. But also like any of the other things that could come up either globally or across the United States or even just individually in someone's life.
Yeah, and then from a meso macro perspective, right? Like I think this is also now the there's opportunities here, right? Like especially like what Karen said about like working cross sector. It's amazing that like now that I'm like all of this, I'm on more webinars, more calls than ever before, and like I think this is one of those instances where like coming together and working together, and we're starting to see that, right? And then so for me it's like how can we like providers in the trafficking world get into those spaces, be on those calls, be on the calls with FEMA, being on the calls with your COC, because everyone's having these calls and making sure that like the needs of survivors are present in those calls, and making sure that like, hey, then we can allocate some of these housing funds, right? Like Julie said, there are opportunities for more rapid rehousing, right? Like how can we then do short-term rental assistance for some of them to get on their feet? There's going to be money for WIOA, right? Like so like workforce investment through the CARES Act. How can that also be tapped in for survivors, right? Like I think there's a lot of opportunities here, and then how to make sure that the voices of survivors are at that table and that we are championing that.
Wonderful. Thank you so much. That is really fantastic and some really great ideas on how to move forward, knowing that the needs, especially the housing needs of young people and survivors, they're going to be here now and after the pandemic, and we need these resources. We need to collaborate now and after the pandemic. I think this has highlighted just how much people need to rely on safe housing, how people need to have safe housing, to be able to even quarantine or to wash their hands, right? And so there are communities that we know are being impacted disproportionately, that are more vulnerable. And so we just want to acknowledge that not everyone's going to have the same access. but we do hope that we can contribute to the collaboration efforts. And so we will be sending out a recording of this call along with some of the, or all of the resources that were mentioned. If you find a resource that is helpful to you, please let us know, because again, we want to cross-share the information. We want to really stress how important it is to collaborate with your different systems that are going to be getting that additional funding, but also that you advocate on behalf of your clients, not just to those systems, but to the funders. They need to know that there needs to be a lot of flexibility, not just during the pandemic, but always. This needs to not, once we return to whatever our new normal is, we cannot continue to operate the way that we have historically operated, because this has highlighted a lot of the flaws in our systems. So we wanted to let you know that we're all in this together. Some of us are being hit a lot harder than others. We hear you. We hope that you are hanging in there, and we will be continuing to do support calls around different topics and demographics as we hear the feedback from you. So we want these to be useful. Everyone's on a million webinars right now. We don't want to add another call to your schedule, but please let us know what you would find useful, because we want to make sure that we're filling gaps and needs versus just adding more. Again, thank you to all of our panelists. That was extremely helpful. We'll be following up next week with a recording and also the resources that were discussed and any additional resources that people may share with us. Thank you again, and we'll be talking soon.